S-shaped bone is the clavicle. This dog ear or elephant ear shaped bone is the scapula. Remember that your shoulder slopes this way. This goes out towards the joint. This is scapula. This is the glenoid cavity. Spine. The acromion on the end. And this hook is the coracoid process. Supraspinous fossa, infraspinous fossa, subscapular fossa. This is the humerus. Remember that the head of the humerus fits into the glenoid cavity of the scapula, so this would be medial and proximal. All right, head, neck, greater tubercle, lesser tubercle. Deltoid tuberosity. Okay, follow the head down. You have the medial epicondyle, and the opposite would be the lateral epicondyle. And this pit on the back is the olecranon fossa. Radius. The round part goes towards the elbow. This little tip goes at the distal end. Remember that the radius is thumb side, so it would be lateral like this. Okay, head, neck, tip is the styloid process. U is for ulna. Remember this wraps around the elbow on the lateral, on the medial side, and then this little tip will be at the distal end. The head is the entire distal end, and this little tip is going to be the styloid process. The olecranon process is the tip of the U, right here. Hand. Looking at the palm of the hand, you have the hamate right at the base of 4 and 5, and then below that you have the pisiform, which is the round on the end. First row of long bones are metacarpals, everything else is phalanges. Okay, this is your pelvis. Remember, like talking on the phone. You have 3 bones in the newborn: ilium, pubis, ischium. And that's true on the inside or outside. Iliac crest, top border of the ilium. Iliac fossa, this indentation. Acetabulum is the hip socket. Obturator foramen is the hole. You have your greater sciatic notch, lesser sciatic notch. The other ones can only be done here, although you can also see all of those here. Pubic symphysis is this strip of fibrocartilage at the joint. And then the pubic arch is this arch structure right here. Long bone with the extended head is the femur. Remember that this head would fit into the hip socket. So this is proximal, and the head specifically is going to be medial towards the midline. All right, head, neck. Fovea capitis is that little pit right there. Greater trochanter, opposite of the head. And then lesser trochanter is down here. Gluteal tuberosity is the rough patch. All right, remember that our head was medial, so we follow it down. Medial condyle and the medial epicondyle. The opposite would be the lateral condyle and the lateral epicondyle. Patella. Tibia has the kind of heart-shaped flat head, or not head, but end. That is the proximal end. This is the distal end. Don't forget that your tibia is the medial bone in the lower leg. So when you see this tip coming off of the distal end, that is the medial side of the bone. This specific structure is called the medial malleolus. You follow that up and you have your medial condyle, which makes the other one the lateral condyle. Tibial tuberosity is this bump on the top of the shaft. Long bone that looks the same on both ends is called the fibula. The more rounded end is called the head, and then you have the neck. And the more of a pointed or flattened end is called the lateral malleolus. Our foot goes like this. The heel bone is called the calcaneus. This top of the foot that has the arch on it is the talus. First row of long bones are metatarsals, and everything else flange.